Hi, my name is Megan Dole, and I'm going to be performing a physical assessment for my physical assessment class. And I'm just demonstrating that this patient does give permission for me to do this physical assessment on video. Correct? Do you agree that I can do a physical assessment on you?
Yes.
Okay, so first off, when I would walk into a patient's room, I would wash my hands when entering and exiting a room. Also, I would make sure that I provide privacy. I would have the curtain pulled, the door shut, and also make sure the room is well lit to where I can see better. So first we're going to start with the skin over the entire body, and I'm going to be assessing for color, over dryness, or whether it's moist on her extremities, all over her chest and abdomen. I would pull up and see her legs and her feet and the skin color of that. I would notice if for color, and also look for things such as moles and hair distribution. And I would also check for skin turgor by taking the back of the hand and pinching up and seeing how quickly it returns. By doing that, we check for hydration. Let's see. Then what I would do is check for the nail bed. I would press down and see how quickly it returns to pink, whether it's less than 3 seconds or greater, and hers is less than 3 seconds, no problem. Then I would inspect her skull for symmetry and anything irregular that I'd noticed. I'd also have her smile and notice if that's symmetrical or not. Then if all that is normal, I'm going to check for her sinuses. I'm going to palpate all of her sinuses. You're right. Mm-hmm. Okay. And then I would also do some percussion to also assess that and see if does anything hurt there when I touch you in any of your sinuses. Okay.
Yeah.
And then I would check for her eyes. And we do this by coming from the side. And I would check to make sure that her pupils are round and reactive to light and equal on both sides. And I would also check the other side, opposite of that. Then I would check for her ears and see if they're symmetrical. And also I would note any drainage that I've seen, any signs of infection that I noticed there. And then I would look at her nose for symmetry, and then I'd also look up to see any drainage too. Maybe even have the patient ask them if they've had a cold lately or any drainage that they've noticed from their ears or their nose. Then, let's see, I would look at her lips to see if they're dry or moist. Also her buccal mucosa to see if they're nice and pink. I would check her tongue and look at that in detail. And then I would go for her neck, and I would check for lymph nodes here, or if I noticed any swelling. I would also note if the trachea was centered right there. And then I would go for, while I'm there, I might as well check for a carotid pulse. So I'm going to palpate for one of these. And it's nice and strong. We would grade her pulses, and hers are normal. Okay. And then I will listen to her carotid pulse. And I'll be checking to see if it's brisk or delayed. And hers is nice and strong. And then I would palpate her radial pulse, which is locate her thumb and come down. And I would palpate for a radial pulse, and it's nice and strong. And I would listen to both sides to make sure, I would palpate for both sides to make sure that they're equal and that they match. And then I'm going to listen to the heart. And then we'll listen at the second intercostal space to the right. And then a little to the left, which is the aortic valve. and then lower, which is the tricuspid valve. And then I would listen down lower, which is the mitral valve. And this is the point of maximal impulse, and I would also palpate that to see if I could feel that and see how strong it is. Then we're going to go to our pulmonary assessment, and I'm going to listen to her lungs. I'm going to note just her breathing in general. I'm going to look at her to see if her chest is rising and falling, if it looks equal on both sides, or if she's having any difficulty breathing or making any noises when she breathes. And I don't note any of those things when I look at her. So I'm going to listen to her lungs. Anteriorly, I have her laying down to listen. Take a nice deep breath for me. Okay. And to listen to the back of the lungs, if your patient is able, what you want them to do is sit straight up so they can expand their lungs. Nice slow deep breath. And again. Again, I would note if there was any coughing or if the patient complains of any sputum, and I would assess that if she did have that. And then what I'm going to do is have her lay back, and then I'm going to look at her abdomen. And I'm going to be looking for kind of just generally inspecting first to see if I see any abnormalities, any rashes, lesions, anything that would concern me in that way. Any scars of the abdomen. Part of your history is finding out any past surgeries or scars in that way. First, I would listen to her bowel sounds before palpating because I don't want to mess anything up there. So I'm going to listen to all 4 quadrants of her tummy. And I would be listening for full minutes if I needed to. She's got active bowel sounds in all 4 quadrants. Then if we've noticed they were hyperactive, we would note that, or hypoactive in our findings. But she is normal in that way. Then what I would do after I listened, I would palpate all 4 quadrants and notice any tenderness or have the patient tell you, does this hurt when I touch you here? Mm-hmm. No pain noted. On palpation, no tenderness. Then I would assess, go into her musculoskeletal system, and I would assess her arms for symmetry. And again, I'd be assessing her pulses. There. And then I look at her legs and see if they're both symmetrical or not. And while I'm there, I'm going to be checking for any signs of edema. And by doing that, I would follow her shin down and press down. And if there was any edema, which there is not, we would grade it, being whether it's non-pitting or pitting in the stages like 1+ to 3+ there. Let's see here. Then I would be checking for pulses, and I would start by checking for femoral pulses, which I can locate here. And I would assess to see if they're equal on both sides while I'm doing that. And then, let's see, yep, and then I'm going to listen to her popliteal, palpate her popliteal pulse, which is right behind her knee. And those are nice and strong. And then I would move down to her pedal pulses and check bilaterally at the same time to see if they're equal and strong too. And they are. I would also, besides checking for all that, I would make sure that while I'm doing that, I usually make sure that they don't have any tenderness when I flex the foot back, or any warmth or redness or tenderness in those areas. Then I would check the shoulders and make sure they're symmetrical and have them shrug up for you to see if their strength is equal on both sides. And then I would check her knees to make sure that they're symmetrical and lined up correctly. And also, again, being a joint, we look for swelling or warmth or tenderness in any of those. Is her spine aligned? And that would be more if she was able to get up and walk. I would watch her gait and make sure that her spine's lined out. Notice anything, any curvatures to the spine at all. And then what we'll do is, after that's done, we will check her cranial nerves, and we'll start by the olfactory nerve. And for smelling, and I have a cotton ball here, and I'm going to ask her what this smells like. And I'm going to have her smell it for me. And what do you smell?
Peppermint.
Peppermint, which is correct. So that nerve is intact. And then we have the Snellen chart here for her to review. So here I just made sure that the Snellen chart was at the appropriate distance for her to view. And then I'm going to ask the patient what is the lowest line she can read.
Star, plus, circle, heart, and a flag.
And a flag. Okay, so on my chart, I see that this is that her vision is 20/20 on this. And then let's see here. And then for a trigeminal nerve, we're going to palpate her jaw and see how strong that is. And then we're going to do, for her facial nerves, we're going to have her smile, raise her eyebrows. Very good. And we're assessing to see if they're symmetrical or not, and they are. Hearing, for the hearing test, what we do is the whisper test, where we stand behind them and whisper two things in their behind them and see if they can identify the two words that we use. So, and then I'm going to have her repeat the two words that I just whispered.
94, baseball.
Which are correct. Then we're going to check her glossopharyngeal, which would be for swallowing. We can try to gently palpate and have her swallow. Also, we would have her talk and notice throughout our assessment, we would notice if she has any hoarseness to her voice or any difficulty in that way. Then we would check her spinal accessory muscles. We would have her shrug her shoulders, and again check for weakness there and strength on both sides bilaterally. And then her hypoglossal nerve, which is her tongue, so we'd have her stick out her tongue and move it side to side and make sure all those movements are intact. Then the last thing that we're going to do in our assessment is check her mental status. Can you tell me what year it is?
2016.
And what month is it?
August.
Okay, who's the president?
Obama.
And where are you at right now?
Stuart Strath.
Okay, so this patient is oriented to person, place, and time, and that concludes my assessment. Thank you very much.